I'm Olivia, and I'm going to be Brittany's occupational therapist today, and I'm going to be measuring her DIP flexion and extension, and the normal range of motion for DIP flexion is 70 to 90 degrees, and for DIP extension, 0 degrees. Okay, so now we're going to measure Brittany's DIP flexion with the goniometer, and to do that, I'm going to place the fulcrum here on the dorsal aspect of the DIP joint, and my stationary arm, which is this one right back here, is going to be on the dorsal midline of her middle phalanx. And the movable arm up here is going to be on the dorsal midline of her distal phalanx. Okay, so now that we have our goniometer set up, we're going to test Brittany's DIP flexion first. And we're just going to stabilize this joint right here because we only want to see movement from her DIP joint up here. So I'm going to actively test Brittany's range of motion right now of DIP flexion. So go ahead, Brittany, and bend your DIP joint. And when she does that, she has about 59 degrees of DIP flexion. Okay, so go ahead and relax. And then to passively test DIP flexion, all you would do is you would keep your goniometer lined up in the same exact way, and you would just help Brittany move her DIP joint. So we would just do that, and then you would ask when she's feeling any pain. So say she felt pain about right there, 35. It would be about 41 degrees of DIP flexion. Okay, so now we're going to measure Brittany's DIP extension. We're going to keep the goniometer in the same exact line as we did before for DIP flexion. Right now, actively, Brittany is at 0 degrees of extension. Right now, I'm going to put her right here, and we would maybe need to passively, at some point, measure somebody's DIP extension. So to do that, I would just pull her back up gently to see if she felt any pain, and in this case, she can get to 0 degrees of extension.